Mary, Dr. Olson, after reviewing your chart and visiting with you, has decided that you need to have 2 tests, one of which is a colonoscopy. We'll talk about that one first. I'm going to give you some information about your prep. Some very important things to know with both these exams. You will need someone to drive you home because of the sedation you're going to have. We've scheduled your exam for July 23rd at 12:45. I have a list of instructions here, and it's very important that you look through and read these before the exam because there's a lot of prep work you need to do. One of the things for the colonoscopy, you are going to have to get a prep called Fleet's Phosphosoda. It's a solution that you drink. You're going to need to be on clear liquids for the day before the exam. The day before. You're going to be on clear liquids the day before the exam. For 2 days before that, you want to be on low fiber. The written directions that we're going to give you to take home and go over will give you very explicit step-by-step instructions as to when you take the Fleet's Phosphosoda, when you can drink. There's some other things besides that that are very important in the prep. If you take any kind of medication that thins your blood, you need to talk to your primary doctor about stopping it. If you take any aspirin, you need to stop it. If you take ibuprofen, naproxen sodium, Aleve, one week. Tylenol is fine. That's the only over-the-counter pain medication that you may take. It doesn't cause any bleeding. If you're diabetic, you'll need to talk to your doctor about making adjustments in any of your diabetic medications. Okay. On the day of your exam, you'll arrive 15 minutes before the exam, and you'll meet with a nurse who will review your medications, answer any questions you might have, and get you ready for the exam. We'll get an IV started. You will get some conscious sedation for this test, which will keep you mellow, relaxed, and comfortable, but you will not be asleep. You will be awake and you will be breathing on your own. You can choose not to have any sedation if you'd like, but we will always put an IV catheter into your vein just in case there is an emergency situation so that we're prepared for it. For your other exam, for the upper exam, where the doctor will take a small scope and look down in your esophagus, down into your stomach, you really won't need to prep for this because you've already prepped for the colonoscopy. It's very important that you have someone here to drive you home. Excuse me. Yes, you can take a cab or a bus if you have someone with you. The reason for that is you're going to have some sedation and a narcotic, and we want to make sure you get home safely. We can schedule this exam around your schedule, your husband's schedule, but we cannot do the exam unless you have someone here to take you home. We will schedule an interpreter for you also for the exam. Do you have any questions for me, Mary, about either of the exams? I do have several pages of paperwork for you to look through and read. That's a very good question. We have some phone numbers on the front for someone to call. Excuse me. We do not have a TTS. Is that what it's called? TTS? I'm sorry. We do not at our clinic have a TTY. Wonderful. And you can call, there is a 24-hour nurse phone line you can call, which is the last number, and there's a daytime number where a nurse is available between 8 o'clock and 4:30. Any other questions for me? Yes, we will not do the exam without an interpreter here, so we will make sure to schedule and the interpreter usually comes a half an hour before the exam. We ask you to be here 15 minutes before so that you'll both be there so that we can go over everything and answer all your questions. Okay? Do you have any more questions for me? All right, Mary. Well, I'll see you in a couple of weeks.